Hello, everyone. I'm excited to be on here again today. Um, have some interesting new things that I've been working on. As we get questions coming on, I always like to fill you in on any new things and any things that are happening. If you haven't checked out the elderberry supplements or products that we have, those are all new online this week. And they are some pretty incredible products. I learned about elderberry because I just knew that it was an old-timey medicine, something that people often would use. So I planted an elderberry bush in my backyard here. And every single spring, I cut the elderberry bush. I prune it down almost to the ground. Literally, I'll leave maybe 4 inches of all that's left of all the stalks that grew. They will grow 10 feet tall by the end of the summer and be covered in berries. It's kind of crazy how prolific these elderberry bushes are. So I've planted, I think I have 4 bushes out there now, and we harvest them heavily. So I would use those elderberries and make elderberry syrup. What I do is I harvest them, and I dried them one year, and it's such a pain because there's so many little tiny berries, but now I freeze them, and then I just pull out enough that I can make a syrup with. The problem with it is I didn't love how much honey is in there. It's actually a lot of honey, and you have to use a lot of it. So you have to use a couple tablespoons at least. So I love these new products because they're concentrated. You don't need to take nearly as much. You need to take a teaspoon. That's about all you need. And then I've also added special herbs that will be for energy. So there's an energy one. This is my favorite. And sneak peek, I'm actually creating an energy drink right now. Energy drink that'll be in packets that you drop into water. Anyway, but this elderberry energy is awesome, but there's also one that has an additional immune benefit, some additional immune herbs, and there's also one that has additional inflammatory herbs with it. So check them out. I also have 2 teas, one that's a wake up. It's a citrus ginger elderberry. So it's a wake up and helps with immunity, especially this time of year, the cold and flu season, which is miserable for so many people. And then there's a go to sleep, kind of calm you down, relax, stress reliever, all those kinds of things in the evening. I love to end my night with that because it's a chamomile rose. It's a beautiful tea. It kind of creates this beautiful pink tea. Sometimes I add a little cream into there and some sweetener, and it's often the thing that I'll end my day on. So check them out. They're all on sale, 15% off right now. All right, let's talk about some questions. Do I recommend oil pulling with organic coconut oil? So first of all, let's talk about oil pulling. I've actually talked about this a lot, but what it does is that bugs in our mouth, bugs anywhere, are surrounded with what's called a fatty membrane. So it's basically just all fats around the outside of them. All of our cells are surrounded by the same thing. That's just kind of how we're made. But the bugs are as well. So when you put a fat in your mouth or oil in your mouth and you pull, so basically you're swishing it around, it pulls, it attracts fat to fat, attracts fat, and it'll pull the bacteria out from the nooks and crannies of your mouth. We like bacteria in the mouth. Some of them are very, very helpful. So I don't necessarily like you to oil pull every day. So I will tell people oil pull for, three times in a week or so. And then you only need to go about every 3rd day on oil pulling. That's a great way to do it. All right. What would we recommend? What would I recommend for a dry mouth? No amount of drinking water seems to help long-term. So there's a couple possibilities for dry mouth. One is that this could be medication induced, meaning that you're taking a medication that is leading to those dry mouth problems, dry mouth symptoms. Another one is that sometimes this is hormone based. Sometimes it's also disease-based. Something's going on in your body that's actually leading to that dry mouth. There's an autoimmune disease called Sjogren's syndrome that one of the characteristic symptoms is a very dry mouth. Either way, what the key thing that you want to do, well, 2 things you want to do. You want to try to stimulate the saliva. So you're going to want to stimulate those saliva glands, those salivary glands somehow. And the second thing you want to do is you want to protect the teeth, because the saliva is actually the body's natural tooth protectant, and it's a natural tooth cleaner. So when you don't have saliva, plaque sticks on the teeth. It's not removed frequently like it should with saliva. And I will see someone who has a dry mouth go from having 0 cavities to having 20 cavities 6 months later. They're all usually gum line. They're all right around the gum line because that's where the plaque accumulates first. It's the place that our tongues don't get to as easy. The food doesn't knock off as easy. So it's usually right on the gum line. It's also the thinnest enamel. So it's the place that's most vulnerable. So what you really want is to do those 2 things, stimulate the saliva, but also protect the teeth. So that's actually one of the main reasons that I formulated my mouthwash, was for these 2 things. The mouthwash has marshmallow root, which is a natural It's kind of a lubricator, makes things kind of slippery, but also stimulates salivary flow. So it has marshmallow root in it, and it has hydroxyapatite, which is exactly what you need to be able to protect those teeth. But triple threat here, it actually has colloidal silver. And there's research showing that colloidal silver combines with the hydroxyapatite to infiltrate or get into that plaque. So even if you have less saliva, the hydroxyapatite and the silver get into the plaque and make it a resistant plaque, meaning it won't create cavities as easily. So if you have dry mouth, 100%, you're going to need to use the mouth rinse. And here's a little known fact, the breath spray is the mouth rinse. So buy one breath spray, use it all the time, put it in your purse, wherever you're going, spray your mouth anytime you need with that, but you can refill the breath spray with the mouthwash. So get the mouthwash, you can refill the breath spray. It's the same thing. It's just in a smaller bottle. So get both. Extremely, extremely important. The other thing you may want to look into is zinc. Zinc will often help with dry mouth. It'll also help with burning mouth syndrome, which sometimes accompanies dry mouth. So add zinc. So a zinc supplement, a zinc lozenge is even better. It makes a kind of a funky taste. I know this is one, Zypan and things are ones that people use for to reduce the longevity of your cold, but zinc does help with mouth health as well. So try adding some zinc. Same problem. Yep. So dry mouth is a big deal. All right. I'm going to jump over to these for a minute. Is there a reason for deep cracks in our very back teeth as adults? Deep cracks in the very back teeth. Well, we have natural teeth. Natural cracks are natural grooves in the chewing surfaces of the teeth. They are what intermesh to allow us to chew. If you're getting deeper cracks and deeper problems, it's probably a bite issue or a way that your teeth are coming together that's actually creating deeper crevices and deeper grooves. So you need to look at the bite relationship, the way your teeth are lining up, the force that you're having. It may be that you're struggling to get enough air, so you're really squeezing, which can create some of those divots in the teeth. So have those things checked out. Does hydroxyapatite toothpaste reverse cavities? So the question is how deep is the cavity? That's the important question. What hydroxyapatite is, and that's what my tooth powder is just a hydroxyapatite tooth powder. And by the way, if you did not see, I have a new formula for a toothpaste. I'm going to do a little insert right here. I kept having a lot of people ask and say, well, you always talk about how you didn't do a toothpaste because it doesn't get into the teeth as well. Well, here's the thing. I actually formulated this toothpaste without all the things that I didn't want and without all the things that prevent the hydroxyapatite from getting into the tooth. So it has no glycerin, it has no gums, it has no, what are all the things I left out? Basically, it has no binders. It has none of the things that create interference with the hydroxyapatite getting into the tooth. So that's coming very soon. It's in R&D right now. But side note, does hydroxyapatite heal cavities? The hydroxyapatite is the crystal that teeth are made of. So a cavity is simply a hole in the tooth that a bacteria has created or acid has created. So if you can add hydroxyapatite back, it will heal or remineralize the tooth. But the key is how deep is the cavity. If those bacteria have already crawled all the way to the dentin layer of your tooth, which is the inside layer, the second layer in, if they've already gotten that deep, there's a little superhighway of tubes inside of that layer, and that cavity is going to spread quickly, and it's probably spread further than just hydroxyapatite is going to be able to help with. So that's our differential, or how we diagnose in my practice, is we'll look and say, how deep is this cavity? If the cavity is still in the enamel, absolutely, let's go to town on remineralizing with hydroxyapatite. If it's already into the dentin layer, you probably need a dental restoration, and then we're going to use hydroxyapatite to prevent you from having any other future cavities. How do we treat bad cavities that's so close to the nerve so the dentist recommends a root canal instead of a filling? This is a question I get asked so frequently. The key is the tooth still alive? So what they're asking is, if you have a deep cavity that's gotten close to the nerve and a dentist is saying you need a root canal. Remember, cavities are bacteria. That's all it is. It's bacteria that's eating away the tooth and dissolving the tooth from acids that the bacteria create. So the bacteria are actually ahead of the cavity we can see, meaning they've already gone deeper into the tooth than we can actually see, and they're starting to work here even a little deeper. So traditionally, if that bacteria has already progressed till almost to the nerve, you're getting a toothache, you have symptoms, cold, hot, those kinds of things, you know that this tooth has a cavity. The bacteria are pretty much already to the nerve. However, if you still have cold and hot sensitivity, if you can still feel things, the nerve is still alive. So this is where we differ. Instead of typically what they would do is remove all the cavity, including all of the bacteria that are kind of ahead of the cavity, which uncovers the edge of the nerve. Once you've uncovered the edge of the nerve, it's very difficult to heal that, to patch it and heal it. Typically, that tooth is going to die. There's a lot of things that are called pulp caps. There's a lot of things in dentistry that are trying to be able to do a patch on that nerve even after it's exposed, but it's not very predictable. At least it depends. The way we do it is actually fairly predictable. So what we do is we use a special dye that shows us how deep have those bacteria gone. And we remove all the bacteria except for right where, if we removed the last bit, it's going to expose that nerve. What we then do is treat it with ozone. Ozone will kill all bacteria. So it's going to kill all the bacteria that have gone deeper than what we can even see. It's going to kill them all. And then we fill over top of that ozone treated area. So are we leaving cavity in the tooth? Well, kind of, but we've killed all the bacteria in that area. So it's not going to progress. So nothing's going to continue growing in there. We just aren't removing even the demineralized tooth structure. We're leaving it there and filling over it, but there's no bugs left in it. So it's not going to progress. So we're able to keep teeth alive and save teeth. That's really what differs about what we do. So we don't have to uncover the nerve and thus do a root canal. We keep the nerve covered with that tooth. We treat it so there's no more bugs there, and then we fill over top of it. And we do still call it a pulp cap. The pulp is the name of the nerve tissue in dentistry. That's what we call it, as the pulp. So we do still cap or protect the pulp. And we have about 95% success rate on doing that if the tooth is still alive. If the tooth is dead, there's no option at that point. It's either do a root canal or remove the tooth because the tooth has already died. There's no keeping the nerve alive anymore. Another video on sleep, do another video soon on sleep apnea options. Okay, I will do it. Should you do oil pulling if you're doing the mouthwash? So oil pulling is one of those things that you have to know, what am I doing this for? If you have active gum disease, I would actually absolutely do oil pulling. If you have a lot of gut issues, gut biome issues, oil pulling will also probably help with that. If you are just wanting to maintain your mouth and keep your mouth healthy, the mouthwash is going to do it for you. Plus add additional benefits in remineralizing teeth, in helping with gum health, and a bunch of other things. So I actually don't do oil pulling routinely as part of my oral care routine. I just do the mouthwash. Is there a preferred way to do expanders for an 8-year-old? So this is an interesting question. Why would you need an expander in an 8-year-old? That's the first question. Well, a lot of things in our world have actually changed where mouths are growing very narrow. This is why everybody seems to need braces and we don't have room for wisdom teeth anymore. There's a lot of reasons for that I won't get into right now, but a lot of it has to do with our food chain, our food supplies, a lot of the oral habits that we're giving babies with the things that we use in their mouths. So mouths are often very small. Well, is this a big deal? It's a huge deal because it affects how you're going to get air and how kids get air too. If you think about it, the mouth is just like it's a house, is what I like to think of. It's a house for your tongue. It's a house for the tissues in the back of the throat. And if the house is very, very small, the tongue can't fit. It's not that the tongue is too big. It's just that it can't fit in the house that it has. So then it has to go backward. It has to go somewhere. It has to go backward into the airway. And it often blocks off air, leading in kiddos to ADHD symptoms, attention focus issues, bedwetting, sometimes irritability, those kinds of things, because they're just not sleeping well. So what we do is we make the house bigger. Make the house bigger. Now the tongue has plenty of room to come forward into that house and it doesn't have to go back into the airway. So what do we do? Well, the nice thing on an 8-year-old is there's a lot of options and most of them are really quite effective. The only thing I don't love is I don't love it when it's done very, very rapidly. The key with bone growth, with orthodontics, with anything, why does it take a long time? Well, because what you're doing with an expander is you're actually opening up what's called the suture, or the little division in the bone on the roof of the mouth. You open it up. Well, if you just keep opening it up, it doesn't actually give the body time to fill the bone in. So then you take the expander off and it's going to move back again. So we do slower expansion. We do a little bit of expansion. We let the bone heal and fill in. We do a little bit more. We let the bone heal and fill it in. That way, when the expander comes off, the expansion remains. Same thing happens with braces. When a tooth is moved through the bone, it destroys the bone on the front side of the tooth, builds the bone on the back side of the tooth. If you do it too rapidly, it doesn't give time for you to build the bone on the back side of the tooth, and you actually get tooth loss, bone loss, all sorts of trouble. So anything with bone should be done slow enough that allows the bone to heal. So fixed expanders are wonderful on kids because they don't have to remember to put them in or out, but there are removable expanders as well. There's a few different options. The key is give it enough time to actually have that bone formed before you remove the expander. Should I use the tooth powder to see if it rebuilds my enamel before visiting an airway doctor? So those are two totally different things. Airway is all about what's going on with structurally with, do you have enough room back here for air? Tooth powder is all about, do you have cavities? And are they, how big are they? So if you're worried about cavities, do you do the tooth powder first? I would actually recommend doing it for about a month and then go see how deep these cavities are if you need dental treatment. If it's airway, just get going there. When will the toothpaste be ready to purchase? I'm excited about it. Me too. I just got to get a manufacturer to finish up. So it's going to be a few months, but it's on the radar. It's coming. What causes the overgrown bone in your lower jaw under the tongue? My husband has this. Good question. So what she's talking about, I'm guessing this is a woman. Anyway, extra bumps of bone right down in there. And a lot of times they bother you when you get dental x-rays because we're shoving these dental x-rays down. You go, ow, it's hitting into that extra bumps of bone. What is that from? It's from squeezing and grinding, clenching usually, squeezing your teeth. Why do you squeeze your teeth? Because you're not getting enough air. So the bone actually grows in response to pressure. So the more pressure you put on here, the more bone growth you get. I always remember a woman, she had these huge, huge ridges of bone on the outside of her jawbone, so big that you could see them through her cheeks. Like you could see her cheeks poking out because of these bumps of bone. And she was like, what is this? I said, a lot of times this is from airway issues. And it was early on. I was just learning about airway stuff. It's a little, clenching. And she goes, I don't do any of that. We did a whole bunch of dentistry on her. And then I said, I really think you need to get a sleep study. She got a sleep study, severe sleep apnea. She wasn't recognizing the symptoms that she had as sleep apnea, severe sleep apnea. So we actually went in, removed the extra bumps of bone. They won't grow back now that we've actually treated her apnea, her sleep apnea as well. If your permanent tooth came in brown and discolored due to an injury in a baby tooth, what can you do? Can it be fixed? This is for a 10-year-old who is upset with a brown spot on a front tooth. That's tricky. So what happened is that baby tooth was probably pushed back against the developing permanent tooth and created a scar on the tooth. So a couple of things can be done. Depending on how dark that brown spot is, you can whiten and it will whiten everything around it. But if it's brown, it's probably going to make that worse. So what needs to usually happen is there's a procedure where they actually removed just a little bit of that tooth structure and then do a resin or composite, basically white filling over top of it to block the color. So you're probably going to need a dental treatment on that one. Isn't elderberry bad for lupus patients? Just curious. Actually, I've never heard that it's bad for lupus patients, so I guess I'll better do some research on that. It's anti-inflammatory. It does increase cytokines. So cytokines are the inflammatory mediators in the body. Why would we want to increase them? Because that's more soldiers, basically. But with any autoimmune disease, your soldiers are already a little screwed up. So it might be that it's the cytokine issue with elderberry. It's a great question. I'll look into that one. I've heard that using elderberry for an extended period of time loses its effectiveness and that we should just use it when we're sick or feel something coming on. Is this true? Or is this drink something we could drink daily? Great question. I'm drinking it daily right now. Am I going to need it in the summer? Probably not. I'll probably take a break from it. I might just use the elderberry tea in the evening because it has a lot of other herbs that are along with it. So I'm using it pretty much. I don't know about you, but where I am, everybody's sick. Like everybody's sick this year. So I'm using it all through this season. We'll see how long 6 season lasts. And it's going to be effective as you use it that way. When we hit, May, June, July, I probably won't need it right then because nobody's going to be getting sick. But then I'll pick it up again in the fall. So it is used a little bit as needed or preventative if a lot of people around you are sick. Good question. Is the elderberry tea organic? It is. Thoughts on using peroxide as a mouth rinse. So peroxide is incredibly caustic, meaning it actually can damage your gums pretty easily. So if you're going to use peroxide, you're going to want to use it very diluted. And it does oxidize things and it does kill bacteria some. But in my mind, I just love the mouthwash because it's going to give you additional benefits. So not only is it going to kill bugs, which is what the peroxide is going to do, it's actually going to give herbals that are going to soothe the gums. It adds hydroxyapatite, which is going to heal the teeth and protect the teeth. Anyway, it just has a lot of additional benefits. So peroxide's fine, but make sure you use it really dilute. It just might be that there's some other benefits you'd also like. What can be done for gums that are receding very seriously? I've already had one very painful gum surgery where they took the skin from the roof of my mouth. Yeah, gum surgery is not that fun, and it's not that successful if you don't determine what is causing the gum recession. That's the key here. A lot of times, well, it could be gum disease, which that needs to be absolutely treated before you do any kind of gum grafting. But more often than not, I find it's actually the position of the tooth. So if your tooth is tipped in like this towards your tongue, what happens is when you're chewing on the tooth is meant to chew like this. But if you're chewing like this, it actually flexes the tooth as you're chewing. The flexure point is right where the gums hit the tooth. So the flexure point is here, the gums move down out of the flexure point. So sometimes it's the way the teeth are hitting. If they're hitting at an angle, it's going to flex the teeth and cause a lot of gum recession. Sometimes it's you have very thin gums. You are born that way. And if that's the case, then you need to be very, very cautious on dental work that you're doing, on where we're moving teeth in the mouth, a lot of different things. So really the key is asking the dentist, why is this recession happening? And making sure that that's addressed before doing grafting. Adding mouth rinse to my water pick for gums. Should I brush with a tooth powder before or after? Worried that either way, one rinses off or scrubs off the good from the other. Good question. I always recommend the tooth powder first. And then if you're adding the mouthwash, you're also going to add hydroxyapatite back. So you don't have to worry about using the mouthwash too close to the tooth powder, as long as they're both hydroxyapatite containing. If you're using a different rinse in the water pick, then you're going to want to wait for about 20 minutes or so. Let that hydroxyapatite do its job. Am I okay with crowns? So I am, based on what is the purpose for the crown. If a tooth has a large filling in it and it's weak structurally, it has cracks in it, it has, tiny little edges of teeth with an enormous filling, those kinds of things set the tooth up for breaking. And sometimes the teeth break really poorly. They break all the way down the root, and then you're going to lose the whole tooth. So a crown covers over the tooth, all those cracks, all those weak areas, and makes it stronger again. So if that's the purpose for a crown, then I am all for it. Let's keep a tooth and let's keep it healthy and happy. If it's just a crown to, you have a filling, you have a few fillings. Oh, it looks like it's time for you to do some crowns. No. Make sure that what is the purpose? What is the reason for this crown? But crowns in themselves aren't bad. It's just if they are used when something else could be used instead. We love to use what's called an onlay, which is a little more conservative than a crown. It covers over the tooth, but it doesn't extend all the way down, all the way around. So sometimes an onlay could be used instead of a crown. Are you ever too old to address airway issues? Never too old to address airway issues, because there's so many ways that we address it. We look for infection in the mouth. We can shrink tissue way back in the back of the throat that's gotten long and stringy because of age. Believe me, I got a lot of things that are getting long and stringy because of age. That's one of them. The uvula in the back gets really long and stretched out, so we can shrink that up. We can expand your mouth even older. So there's so many things to do. How should we prepare for extraction and implant, and how can we ensure good recovery? Both my mom and I are getting root canals removed. Thank you for all you teach us. You're so welcome. What you should do is super supplement. So this is an interesting thought that I'm going to be teaching about in my book, actually. Our bodies operate on basically a maintenance level of energy, just electrons, things that we're requiring to run our metabolism, to run our heart, to run our brain. But when we're ill, we are using more of that energy already. So we're already running on low. It's kind of like your phone. You look at it, you go, oh no, I've got 8% battery left. So when you're not well, you're already, at 8%. Well, when you are required to heal, it requires a lot of energy. So if you go into that surgery at 8%, you're not going to heal very well, right? Because you have no energy to expend, to give. You don't even have enough to keep maintained. So you need to super supplement. What gives energy? Vitamin C is basically electrons. So you need to do a lot of vitamin C. So if they'll do vitamin C IVs there at the office, please have them do that before, during, after surgery. 3 days in a row is great. If they don't do it in the office, there's a lot of mobile IV services now. You can go and get an IV. You also need to super supplement omega-3s. So omega-3 fatty acids. You also need to super supplement vitamin D and vitamin K. So you are just going to add a lot of everything. If you go on my website, we actually have these things on there. It's like Omega Boost is a high dose of the omegas. Daily Boost is a high dose of a lot of the other things, vitamin D and K. And I'm not about selling stuff. Go anywhere. I don't care where you go. But just get a lot of these things in your system, more than you would take for maintenance, because you're going to need more to heal. Is it possible to heal tooth decay happening under a bridge? That is so tricky. Tooth decay under a bridge is usually because of the bridge dynamics, physics, basically, of the bridge. What happens when you hit the bridge, when you chew on the bridge, is it, if you chew here, it's going to flex, it's going to flex down here and raise up the other side of the bridge. So it leaves a space underneath the bridge. Most times there isn't a way to heal that or fix that because it's leakage underneath the bridge. It's a broken seal on that bridge. So you're probably going to need to get the bridge replaced. How can you prevent mouth ulcers? My son gets them weekly. You're going to need to figure out what's making that allergic. That's basically an inflammatory / allergic reaction happening. So there's something in his diet. There's something that he's using from a tooth product standpoint that's causing that reaction. If you have somebody near you that does something called NAET, N-A-E-T, it's often a chiropractor that does it, they can identify which foods / substances may be irritating irritating. If not, you just start doing some trial and error. Change the toothpaste, change mouth rinse, take out nuts are a big offender. Take out anything acidic. Tomatoes are a big offender. Just start taking things out of the diet and see if that helps, and change mouth products and see if that helps too. All right, I'm going to jump over here to the other platform. Can I use your tooth powder for my soon-to-be 2-year-old? Absolutely. The kids love the citrus-flavored one. Give that a try. My 5-year-old has multiple cavities, and my dentist is recommending several be capped with stainless steel caps. Is that the safest option? It's so frustrating, isn't it, when you have kiddos that have tooth issues? You can do stainless steel caps. It is metal, but it's not mercury. You also can do zirconia caps. So you can ask if there's a zirconia option. They are more expensive. So it might be that from a financial standpoint, the stainless steel are going to be the ones that you need to choose. I'm okay with them because they're temporary. They're just there for a few years, and stainless steel is more inert than mercury for sure. I clench in my sleep and all I hear is a mouth guard. Plastic in my mouth all night sounds like a bad idea. I'm at a loss. If you clench in your sleep, it tells us that you're not getting enough air. So you need a cone beam CT scan. You need to get a view of what's happening from an airway standpoint. Is it infection in your mouth? Is it tissue is it a mouth that's too small so the tongue falls back too far? So many different things, but clenching is 100% based on airway, and a mouth guard isn't going to help with that. You're just going to get one more thing to clench against. Okay. Do I use Orotox to determine if a root canal is badly infected? I don't, because I can see it on the cone beam CT scan. So we use the cone beam CT scan. That's our diagnostic medium because we can compare it 1-to-1. And we're using it for every other thing too. How do you correct white spots in the tooth? Sometimes those are fluoride spots. So it's fluorosis, hyperfluorosis, excess fluoride. Sometimes it's damage from an injury. Sometimes it's fever. It's from a fever spot. So you can whiten the teeth and see if you can whiten all of the tooth whiter than that spot to make them less visible. You may also just need to cover it over cosmetically with a filling. Your mouthwash and mouth sprays in glass bottles. If you need a smaller amount, if you go somewhere, how important is it to have it in glass bottle? I love glass. But if you're using it for a short period of time, you're not going to pull much from whatever plastic, thing you're putting it in. We put it in glass just because I want it to be able to stay shelf stable, not very inert, not pulling any of the plastic particles. There's a lot of research talking about microparticles in plastics nowadays. But if you're using it for a short period of time, I think you're going to minimize that issue. What steps should you take for a child who grinds their teeth at night? All right, first thing you're going to do is go talk to an orthodontist and say what's going on with the growth and development of their mouth. And hopefully they're going to have some answers. The other thing you can do is go online to a service called Toothpillow, toothpillow.com, and they can do this all virtually for you. So go check them out. Are you going to be adding holistic dentists to your list? Having a hard time finding someone in Virginia Beach, Virginia that believe in healing the teeth. So I've got a great friend actually out there. And I think she's in Virginia Beach too. Lisa Marie Samaha is her name. So check her out. I thought she was on the directory, but make sure, check it out. She's great. We're adding as many dentists as we'll join. Basically, we're trying. How long does it take for inflammation around the airway to go down after cavitation surgery? So what she's talking about is if you've had infection that's been cleaned out, how long does it take for inflammation to go down? A large part of that is how does your body heal? Is your body primed to heal or not? So super supplement, add a lot. Do anti-inflammatories like natural ones, turmeric, ginger, add those things to your regimen and see if you can't calm this down. We say anywhere from 3 to 6 months, but I think you can speed this up if you try to really add some anti-inflammatories in there. All right, I have an appointment. We've got some growth going on at Total Care Dental, and I've got contractors to go meet. But these are awesome questions. We're going to just keep going here, and we'll try to answer some of these online on the online platform as well. But thank you for continuing to show up and asking such great questions. You're all amazing. Keep watching, and we're just going to keep sharing. Have a great day.